Assalamu alaikum. This presentation is on the surgical needles, the properties, the design, the geometry, and which needle for which job. Modern surgical needles are made up of steel alloys and are often coated with silicone or similar compound. They are as sharp as possible to ease the penetration into the tissues and to ease passage through deeper tissues with minimal resistance and minimal tissue trauma. It should be as slim as possible, and that is dependent on the tensile strength of the material of the needle. If the tensile strength is high, the needle can be as slim as possible to again decrease the amount of tissue trauma and decrease the amount of pressure required to pass the needle inside the tissues. They should be rigid, that is to say they would resist bending within a certain range of resistance. But they should be ductile, that is to say, before they break, they should bend a little bit. This will give a surgeon a warning that this needle is facing resistance and it may break, so that he can stop pushing the needle against resistance and avoid breaking the needle and losing a part of it inside the tissue. That's the needle ductility. They should be stable while being grasped. This would provide enough precision to pass the needle exactly where the surgeon would want it to pass, and avoid the needle rocketing or wobbling while being catched by a needle holder. And of course, they should be sterile and corrosion resistant to avoid leaving around in the tissue any amount of foreign material. Most modern needles are now coated with a micro-thin coating formed of silicone or a similar synthetic compound. This improves significantly the ease of penetration of the needle into the tissues and decrease the amount of force needed to drag the needle inside tissues in the body. Sharpness of the needle can be roughly estimated by the ratio between the length of the point to the diameter of the needle itself. Somewhere around 12:1 ratio would mean that this needle is sharp enough. Some needles are sharp, some are very sharp, and some are less sharp depending on the type of the needle required for a certain surgical job. By the strength of the needle, we mean its ability to resist deformation if facing some resistance while being passed inside tissue. There is a point called the surgical yield point. All surgeons would have acquired this sensation that this needle is facing resistance and it's going to bend if it is pushed any further. It refers to the amount of angular deformation, the amount of bending of the tip of the needle while being passed into tough tissues against resistance. Good needles would resist deformation within a certain range. This is about 10 to 30 degree of bending. Anything more than that, you would risk the needle being broken off and some part of the needle being left within the tissues. Reshaping the needle after bending is bad practice because a bent needle may cause it to lose strength and may precipitate a breaking of the needle with further passage and further resistance. While the needle strength is measured by its ability to resist bending, the needle ductility is its ability to resist breaking. The ductile needle would bend before it breaks. When facing resistance within a certain range, the needle would first bend, and this will give the surgeon the early warning to stop using the needle or stop trying to pass it against this tough resistance or tough tissues. Bending and breakage of needles should be avoided at all costs. It's best to use the needle, drag the needle exactly in the direction of the needle body. This would reduce the amount of force needed to drag the needle and would minimize the possibility of bending or breakage of the needle. And now to the needle geometry, the anatomy of the needle itself. 9 different aspects of design in the needle, starting from the very end, the needle tip. The needle tip is the very last end of the needle. This is the first point to penetrate, followed by the needle point. The needle point is the distance between the needle tip and the needle body, the maximum diameter of the needle, the thickness, the maximum thickness of the needle itself, up to the needle tip is called the needle point, followed by the needle body. This is the maximum thickness or maximum diameter of the needle that provides strength. And then the holding segment. This is the segment which is cross-hatched or ragged to provide enough friction for the grasping needle holder to hold the needle with precision. And then the needle eye, where the needle is joined by its suture line. So these are the 4 aspects of the needle itself, plus the curvature of the needle, how curved it can be, 1/8, 2/8, 3/8, 4/8, that is 1/2, 5/8, different degrees of curvature that we'll go through in very shortly. And then the size, 2 aspects to the size. There is the diameter, which is the thickness of the needle body itself, the thickness of the needle material. And there is the radius of the needle curvature itself. And then the length of the needle, again 2 aspects. There is the chord, which is the distance between the needle eye and the needle tip. This distance is called the chord, and the needle length is the length of the needle itself along its curvature. We will go through these one by one. The needle eye is the point of attachment of the suture line to the needle. Earlier needles in the past were either having a regular eye through which the suture line would be threaded by the surgeon or the scrub nurse, sometimes with more elaborate eyes, like eyes with a spring or a double spring, but they are very rarely used nowadays. Most modern surgical needles are provided in the atraumatic form, where the end of the needle is perforated by a laser beam through which the suture line will be threaded and secured in place by glue or a similar product. Sometimes they can have a rolled end with an extra cuff of material on top in order to secure the suture line inside the needle. This design with the atraumatic needle provides the least amount of resistance to the suture and the needle when the needle is passed within the tissues. The needle stability is important in order to provide precision in forcing the tip exactly where the surgeon wanted to perforate the surface without any rocking movement or wobbling of the needle within the needle holder. The first 1/3 or 1/4 of the needle is formed of the needle eye. This is the perforated part of the needle body through which the suture line is threaded, and therefore it's very weak. It's just a shell of steel around the suture line, and holding the needle in this area would risk a needle being bent or being broken. This is where most of the needles breakage would happen. The needle would be grasped a bit distal to the initial 1/3 or 1/4, this area there, with it is usually either cross-hatched or rubbed in order to provide enough friction with the needle holder to provide better stability for the needle and allow precision in the introduction of the tip into the tissues. Perhaps the first or the oldest surgical needles were straight. They provide enough stability and enough precision in the passage of the needle through tissues, but it's often difficult to retrieve or see the tip of the needle after it passes into deeper wounds or cavities. That's why curved needles were introduced. There are the very shallow curved needles, the 1/4 circle. These are used in the surface, used for example, skin wounds. A little bit more curvature, like 3/8, are used again for skin or very shallow wounds. But it is the half, this is the 4/8, the half circle, and the 5/8 circle that are used in cavities or deeper wound. Perhaps the half circle is the one that is used most for general purposes and interior of most wounds. The 5/8 type of curvature will be used in deeper cavities, deeper surfaces or deeper wounds. And also the J-shaped can be used for deeper wounds. It would be easier to identify the tip and retrieve the needle through identifying the tip and the deeper tissues of the deeper wounds. And then there are the compound needles, which have different degrees of curvature along their path. They may have a very curved tip, for example, and a less curved body and a less curved segment for catching the needle. So these are the different designs for curvature of the needle. The needle point is formed of two parts. The needle tip is the very last part of the needle point. This is the point that meets the maximum resistance while penetrating into the tissues. It can be sharp or it can be blunt if it's meant to pass through friable tissue like liver or the kidneys or infected granulations. The rest of the needle point is the distance from the needle tip to the maximum thickness of the needle. The maximum thickness is the needle body. So all this area from the very last tip to the maximum thickness is still the needle point. And again, it can be either rounded and to be blunt, or it can be sharpened like knives with 2 edges, 3 edges, sometimes 4 edges as well, for the easier penetration and cutting into tissues. Whether surgical needles are blunt or cutting depends on two things: the body of the needle and the needle point. The body of the needle can be blunt, like circular, so that it would not cut into tissues, it will just going to spread it while passing through it, or it can be cutting. It can have a configuration of a triangle with 3 cutting points, or a rectangle, or a trapezoid with cutting edges. The other aspect is the needle point. Even for a blunt body, you can have a sharp point, a taper point at the end that tapers into a circular body. So it would have enough sharpness to penetrate into, for example, a kidney or a liver, followed by a blunt body afterwards. It will still be called a blunt needle. And it can have also a blunt point from the very start and a blunt body at the following segment. Cutting needles can have cutting bodies and also different shapes of points. of needle points. They can have a taper cut point like a trocar. They can have a slim blade like a knife. They can have a conventional cutting, which is triangular with the cutting edge towards the inside of the circle of the needle, or the reverse cutting with the triangular again, but the cutting edge is to the outside of the curvature of the needle. So with different designs of the needle tip, the needle point, and the needle body, you can have different needles for different surgical functions. The blunt needles, these are the two blunt needles, can have a body which is either rectangular or cylindrical in shape with no cutting edges. It will spread the tissues during its passage. Within the tissues itself, tissues will be separated up and down the body without any cutting. But the points of these two needles would differ. You can have a blunt body and a blunt point passing through friable granulation tissue, or you can have a blunt body and a taper point passing through the surface. You would need only the point to be the needle to be pointed at the very tip in order to pierce the capsule of the, for example, liver or the kidney, and then the body itself would be non-cutting, would be blunt, so there would be minimal trauma. For the cutting needles, again, they can have cutting bodies like triangles with cutting edges. If the cutting edge is looking towards the curvature of the needle, this is the conventional or the type of needle, or it can be looking to the outside of the curvature like the reverse cutting needle. You have different designs of the body for cutting needles. Some of them are also a little bit more cylindrical, and some of them are trapezoid like the spatula needle. The tip of the needle, the very last part of it, would also have different shapes for the cutting needles. They can have a slit shape like a knife for the conventional cutting, or they can have pointed for the reverse cutting, or they can have again a knife-like cutting edge and the cutting edge of the needle, or they can have different trapezoid shapes, or a triangular and then an almost surgical type of tip for the taper cut needles. So these are different designs of needles, different designs for the body, different designs for the point, and different designs for the tip. We shall go through them one by one. We start with the blunt needles. There are two common blunt needles. They are designed to minimize the cutting action of the needle. They just dissect and pass through the tissues with minimal cutting. For that, their bodies are designed in such a way as to minimize the cutting. The needle points are usually circular or cylindrical. That's why it wouldn't cut into the tissue. And the rounded point gradually transforms into either a cylindrical or a rectangular body. So these features are shared by the two blunt needles. They differ in the tip, the very last bit of the needle. This particular blunt point needle has a rounded tip. It's not sharpened at all. It's rounded so that it doesn't cause any, it penetrates without causing any cutting action or any the minimum damage possible to the tissues itself. So it's used in very soft tissue that you don't want to cause any cutting into it, like liver, spleen, and the kidneys. The other blunt needle has a very sharpened tip, like a trocar, and this gives it its name. It's a taper point needle. It still have a rounded point. The needle point itself is rounded. It's only the tip that is very sharpened. and the rest of the needle body is again either cylindrical or rectangular in shape. This type of needle is commonly used for subcutaneous tissue. It wouldn't pass easy through the tough dermis of the skin, but it's used for the subcutaneous tissue, including subcutaneous fascia, the muscles, the nerves, blood vessels and stomoses, the dura and the pleura. You only need to select a proper curvature for a particular task, but this needle is the common needle for most of these surgical actions. But when needles are needed to suture tough tissue, offering high resistance to the needle passage, then it's the cutting needles that you need rather than the blunt needles. And cutting needles are designed to offer cutting edges in the very tip and also in the point between the tip and the rest of the needle body. And they differ in these two features. Some of them would have a very pointed tip, or a slit-like tip, or a triangular tip, and most of them would have a triangular point looking either upwards or downwards depending on the type of the needle. This conventional cutting needle is the one most commonly used for skin suturing. It cuts with its very sharpened tip, and then the triangular design of the needle point allows easier passage through the thick dermis. Note that the apex of this triangular cutting point is looking towards the needle curvature. So the cut would be formed within the loop of the knot of the suture at the end. This needle is used for the skin, but care must be taken when you are suturing mucosa or tendons because of the cut within the loop of the suture. The conventional cutting needle is not ideal for mucosa and for ligaments or tendons because the apex of the triangular cutting point is looking within the loop. And that's why the reverse cutting needle was developed. It differs from the conventional cutting needle in two aspects: its tip and its point. The tip is not a point here, the tip is a slit. It cuts like a knife in the first penetration through tissues. And the needle point, the area that followed the needle tip, is again triangular, but this time the apex of the triangle is looking outside the curvature of the needle, and this minimizes the cutting in the loop of the suture that is knotted at the end. Because of this design, the reverse cutting needle has more strength cutting through tissues than the conventional needle, and it also its danger of cutting through the knot itself or a very thin rim of tissues is reduced because it cuts outside the loop. It's the one that you need to use if you are suturing ligaments or tendons or mucosa, including oral and nasal mucosa. Another cutting needle with a different design is the side cutting needles. And this needle, you still have a very sharpened tip. The tip of the needle is very sharpened into a point-like, but the needle point itself, the area following the tip, is trapezoid rather than triangular. So it actually does not cut the tissues above or below the needle. It cuts sideways, and is therefore useful in ophthalmic operation when you just want to pass the needle through the tissues rather than cutting the tissues above and below the needle itself. It's also, because of this design, it's very stable because it's a trapezoid. It's very stable within the jaws of the needle holder. And it got some ribbing in here as well that interlocks with the fissures in the tip of the needle holder. Taper cut needles are hybrid needles. They combine features from cutting needles and blunt needles. The clever design has it that the needle tip, the very last millimeter of the needle, is cutting. The rest of the needle is blunt. So for the needle point, it has a very sharpened needle tip, and then it has a triangular cutting edge, like a reverse cutting needle looking outside the loop of the knot. But that's for the last millimeter, less than the last millimeter of the needle. After that, the needle has a rounded body, a rounded point that transforms gradually into a cylindrical or a rectangular body, allowing some stability of the needle itself. So it has a trocar at the end that pierces through very tough tissues, but only for less than 1 millimeter. After that, it doesn't cause any further cutting. It just glides through the tissue. And that's why it's used with cartilage, like if you are suturing into a trachea or the nasal septum or doing a penoplasty. It eliminates the danger of cutting after the initial perforation of the surface with its trocar-like needle tip. Sternotomy needles are again hybrid needles that combine features from cutting needles and blunt needles, much like taper cut needles. And they are used when needle strength is required to pass through tissues of maximum resistance, including calcified tissues or heavy cartilage. Much like the taper cut needles, they have features of cutting needles at the very end of the needle, and the rest of the body looks like a blunt needle. They differ from the taper cut needle, however, in several aspects. The needle tip here has a conventional cutting triangular edge, so the apex looks inside the curvature, while the taper cut needle has a reverse cutting tip. So that's one thing. The other thing is that the tip of the needle here the cutting tip extends for a hole of 6 millimeters. The taper cut needle only extends for less than 1 millimeter at the very distal part of the needle. This needle also has more strength in it. The body is heavier, and it's flattened into a cylindrical or a rectangular shaped body, again with ribs inside here to increase the stability of the needle and prevent rocking of the tip while it is passed through very dense calcified tissue or cartilage. When precision is of utmost importance because of the fragility of the tissues handled, or because of you doing a cosmetic surgery and you want to minimize the amount of collateral damage during the passage of the needle, few modifications are required to the needle you need. You need maximum stability by either a rectangular or a square body that allows the maximum grip of the needle holder on the needle itself. Also, the tip of the needle is very sharpened like a knife, and the needle point extends for the last 1/3, the distal third of the needle, rather than just for less than a millimeter in the taper cut or 6 millimeters for the sternotomy. The cutting point here extends for the distal third of the needle, and it's a reverse cutting type of needle with the apex of the needle looking outside, and this minimizes the amount because of the thinness and the sharpness of the tip, it minimizes the amount of the damage to the tissues while it is passed through, and maximize the stability because precision here is of prime importance. Similarly, the PC prime needle is similar to the precision point needle, and that they are needles to be considered when precision and minimal collateral damage to the tissues are required in cosmetic surgery or when the tissues are very fragile. It differs from the precision point needle in that the cutting edge here is conventional rather than reverse cutting. And also because of the material used for the needle itself, of very high strength material, it can be thinned out into a very fine and taper wire shaped tip, and this allows the needle superior penetration power. The rest of the needle body is flattened upside down and also have grooves and ribs inside to allow better positioning and gripping of the needle holder. So it reduces the bending and the twisting of the needle tip when the needle is being passed. This is again one needle for when precision and minimal tissue damage are required. And to sum up, these are the needles that are in common use in everyday surgical practice. Two of them are blunt needles, and blunt needles have rounded body that passes through the tissues by dissection, so they separate the tissues rather than cut through it. They differ in their tips. If the point and the tip are also blunt, and then this is the blunt point needle. This is the needle that you use for friable tissue, for spleen, for liver, kidneys, and uterine cervix. But if the needle point is tapered into a sharpened trocar-like structure, then this is the needle that you use for subcutaneous tissue closure and closure of things like muscles, nerves, blood vessels, the pleura, or the dura. For the cutting needles, they differ in the tips and they differ in the needle points. And if the needle point is usually triangular, but sometimes it can be trapezoid. If it is triangular with its apex looking within the curvature of the needle, then it's the one that you use for common skin closure. But if it's the other way around, if the apex of the triangle is outside the curvature of the needle, i.e. a reverse cutting needle, you can still use it for the skin closure, and you also can use it for mucosa and use it for ligaments and tendons. A TAPERCUT needle is a hybrid needle with very high penetration power at the very tip, and then the rest of the needle, because it's hybrid, is like a blunt needle, and this is the needle that you use to suture things like calcified tissues and nasal septum, oral mucosa, and the like. Spatulated needles are flattened needles like a trapezoid with a sharpened tip, but because of the trapezoid-like body, it cuts sideways and dissect the tissues above and below without cutting through them. It only cuts sideways, and it's usually in common use in ophthalmic surgery. And this is the other aspect of selecting a needle. After choosing a particular needle design, you need to figure out the curvature of the required needles. And a 3/8 circle needle is a very shallow type of a needle that you can use for closure of superficial structures, mostly the skin. If you are working endoscopically or you are doing microscopic surgery, you probably require the 1/4 rather than the 3/8. It has a shallow curve so it allows for less pronation and supination of your arm during the suturing. But this needle is not suitable if you are working in cavities or working in deeper structures. For the cavities and the deeper structures, you need a more curved needle, either a half curved needle when you are working in skin or shallow confined spaces, or the 5/8 circle if you are working within a deep cavity. This feature allows easier identification of the needle tip within the deeper structures, so that you can pick up the needle after its initial rotation. So this is the needle you're probably going to use if you are doing intraoral procedures. By this, we come to the end on this presentation on the surgical needles. Assalamu alaikum.